If you've ever been told this medication works for most people while you're sitting there feeling terrible with side effects or no improvement, this video is for you. The truth is, most people might only be 60% of patients, and pharmaceutical science has known for decades why medications work differently for different people. I'm Olga, and I help healthcare providers understand when custom medications can solve problems that standard approaches can't. Who have been told that their symptoms are normal and that they just need to try another medication, when the real issue might be that their body processes medications differently than the average person studied in clinical trials. I have a doctorate in naturopathic medicine and work extensively with 503A compounding. That's the type of pharmacy that creates custom medications for individual patients. What's fascinating is that personalized medicine isn't new or alternative. It's based on well established pharmaceutical science that somehow gets lost between research and practice. Today, I want to share what I've learned about why medications fail for so many people, and most importantly, what options exist when standard approaches aren't working for you. Let's start with something that might surprise you. Most clinical trials only include people who are likely to respond well to the medication being tested. When pharmaceutical companies study new drugs, they exclude people with multiple medical conditions, people taking other medications, people with genetic variations that might affect drug metabolism, and often people over 65 or under 18. This makes sense for research purposes. You want to isolate the effect of your drug, but it means that the average patient in studies doesn't represent the real world. Here's a perfect example. Warfarin, a blood thinner used by millions of people. The standard dosing was based on clinical trials, but we now know that genetic variations affect how people metabolize warfarin. Some people need doses 10 times higher or lower than the standard dose to get the same effect. The research is fascinating here. Studies show that about 30% of people have genetic variations that significantly affect how they process common medication. For some drug classes like antidepressants, response rates can vary from 30% to 90% depending on individual genetic and metabolic factors. But here's what's really interesting. Even things like stomach acid levels, gut bacteria composition, and timing of meals can dramatically affect how well medications work. A medication that works beautifully when taking on an empty stomach might be completely ineffective with food or vice versa. Let me walk you through some key factors that make medication response so individual. First, genetic variations in drug metabolism. Your liver contains enzymes called cytochrome P450 that break down most medications. Some people are rapid metabolizers. They break down medications so quickly that standard doses don't work. Others are poor metabolizers who break down medications slowly and might get side effects from normal doses. This isn't rare. About 25% of people have clinically significant variations in the CYP2D6, one of the most important drug metabolizing enzymes. This affects everything from pain medications to antidepressants to heart medications. Second, absorption differences. Some people have naturally low stomach acid, which affects how well they absorb medications that need an acidic environment. Others have genetic variations in transporters that move medications from gut into bloodstream. Third, hormone fluctuations. Women's medication needs can change dramatically through their menstrual cycle, during pregnancy, and through menopause because hormones affect both drug metabolism and receptor sensitivity. Fourth, this is where my compounding background really becomes relevant. Some people have allergies or sensitivities to inactive ingredients in the commercial medications, like dyes, preservatives, and fillers. I've seen patients who couldn't tolerate any commercial formulation of a medication, but did beautifully with a custom compounded version using different inactive ingredients. Now, let's talk about when personalized medication approaches make sense and what options exist. Compounding isn't for everyone or every situation. If a commercial medication is working well for you, there's usually no reason to change. But compounding can be incredibly valuable in specific situations. When you need a dose that isn't commercially available, maybe you need a 7.5 milligram of a medication that only comes in 5 or 10 milligram tablets. When you have allergies to inactive ingredients in commercial preparations, or when you need a different delivery method, maybe a topical cream instead of an oral medication. When you need multiple medications combined into one preparation for convenience or better absorption. The research on customized hormone therapy is particularly compelling. Studies show that individualized hormone preparations can achieve better symptom control with fewer side effects compared to standard preparations, especially for complex cases involving multiple hormone deficiencies. Here's what's crucial. Good compounding requires collaboration between you, your prescriber, and a quality compounding pharmacy. Your prescriber needs to understand both your individual needs and the science behind the different formulation options. The pharmacy needs proper quality control and testing protocols. What's really exciting is that the growth in pharmacogenetic testing is happening. Genetic testing that can predict how you'll respond to different medications. While not perfect, these tests can help guide initial medication choices and dosing, potentially saving months of trial and error. Let me give you practical strategies for getting personalized medication care when standard approaches aren't working. First, keep a detailed symptom and side effect record. Note not just what happens, but when, timing relative to meals, sleep, stress, and hormonal cycles. This data is invaluable for identifying patterns that might suggest metabolic or absorption issues. Second, ask specific questions, like what percentage of patients respond well to this medication? Are there genetic tests that might predict how I'll respond? What are alternatives if this doesn't work? Would a different formulation or delivery method be appropriate? Third, research providers who have additional training in personalized medicine. Look for certifications in functional medicine, integrative medicine, or pharmacogenetics. Some pharmacists have specialized training in compounding and can work with your doctor to develop customized approaches. Fourth, understand your insurance coverage. Some compounded medications are covered by insurance and others are not. Some genetic tests are covered, others aren't. Having this information up front can help you make informed decisions. Finally, be prepared to be your own advocate. If your current provider isn't open to exploring personalized approaches when standard treatments aren't working, it might be time to seek a second opinion from someone with more experience in individualized medicine. Here's what I want you to remember. If standard medications aren't working for you, you're not broken. You don't have to settle for feeling terrible. Pharmaceutical science has known for decades that medication response is highly individual. The challenge is finding providers who can apply this knowledge to your specific situation and access to pharmacies that can create customized solutions when needed. Whether that's adjusting doses, changing delivery methods, removing problematic inactive ingredients, or combining medication in ways that work better for your body, personalized approaches to medications can be life-changing for the right patients. The key is working with knowledgeable providers who can understand both conventional medicine and personalized approaches, and who are willing to dig deeper when standard treatments aren't giving you the results that you need. What's been your experience with medications that don't work as expected? Share your story in the comments. Your experience might help someone else realize that they have options they didn't know existed. Subscribe for evidence-based information that helps you advocate for the care that you deserve.